Most people involved in primary care in Wales know that the mental health measure is a new piece of legislation. Well, I've been finding out what the measure says and what it means for GPs and their staff.
The mental health measure has a number of components, so it's dealing with people who need to be in hospital, it's dealing with people who need to be under the care of a consultant psychiatrist, it's dealing with people who need the support of the wider community mental health team. But the most important aspect for me as a GP is when I see people who clearly do have mental health difficulties, who are having life difficulties, it helps me to provide them with support very quickly. First of all, in terms of an accurate and detailed assessment, and then secondly, a range of resources that they can call on to help them get better quickly.
For many years now, most people with mental health problems have been treated by their GPs in primary care. But there's only so much that primary care can provide. For people with increased complexity and more severe mental health problems, we've needed the help of secondary care. Secondary care can't see everyone, and there's been a number of people in between what primary care can provide and what secondary care are willing to see. And these people have been left really in limbo without effective mental health services.
In primary care, we manage large numbers of people and patients with what we now refer to as common mental health problems, which really, in brief, covers that large group of people who suffer with various degrees of depression, anxiety symptoms, which are usually part of the same scenario.
The problem is that it's been quite frustrating knowing that you need services, you need counselling, you need psychotherapy, and not being able to access it. You have to refer these people on to secondary care. Secondary care, if they see them at all, which is difficult, may disagree that this is what they need, and you get people on this cycle of have their needs unmet by primary or secondary care, and it's very frustrating because we can see what needs to be done, but we can't do much about it. And that's when, I suppose, we get accused sometimes of over-prescribing drugs.
The mental health measure sets out to improve this situation.
Wel, fyddwn ni'n deud wrth gleifion bod na fesur newydd ger llaw a bod na wasanaethau newydd yn y gymuned i drosglwyddo gwasanaeth iechyd meddwl yn y gymuned, yn lle bod rhaid yn fynd i'r ysbyty ag aros am wythnosau, os nad misoedd, i weld arbenigwr.
What's in it for patients is that it is a service much more locally, somewhere where it's not at all scary to go to. So people are very used to going to their GP to get medical advice and support, as well as other advice and support, and this is an extra service.
Mae'r mesur yn sicrhau gwasanaeth i bobl o bob oedran, yn cynnwys pobl ifanc a pobl mewn hen oedran.
So it will be a major change in how we work, in the sense that we can actually say to patients, yes, we have got something more to offer you than my time and a prescription for antidepressants, even though that may be is often perfectly appropriate and very effective, but it's something more.
What's new about it is that it's national, so this isn't a postcode lottery. This will be accessible to everybody wherever you live in Wales.
So the measure aims to boost the provision of mental health services available through primary care across Wales. These services are going to be more local, more timely, and for everyone. But what is this going to mean for GPs?
What it means for GPs is that there's going to be a new service offering earlier intervention and additional person power within the practice locally.
Every practice will have access to somebody who they know who has had a lot of training, so that's going to be new. Secondly, wherever possible, that service will be provided in the GP surgery. So
myself, I work in GP surgeries in Barry in the Vale of Glamorgan, and we go into surgeries, the GPs refer patients, we see them then for a mental health assessment, a comprehensive mental health assessment, and then together in partnership with the service user we decide, what the options are.
What the primary care mental health team member will be able to describe is the range of psychological therapies, brief psychological therapies that the team have got to offer.
GPs often struggle to provide anything for the patients other than, medication, They haven't got the time to engage in other things and look around for, what's available. So that's where we come in.
Wel, mae'n gweithio yn dda iawn pan da chi weithiwr unigol yn gysylltiedig efo'ch practices chi. Mae yna berthynas agos rhwng y meddygon a'r nyrsys, ac wrth gwrs y cleifion a'r gweithiwr iechyd meddwl yna. Ond wrth gwrs, nid dyna'r byd fel mae ar un y bryd. Mae yna rhai practices a ddim gweithiwr iechyd meddwl o gwbl. Felly, os yna ddim darpariaeth o gwbl. So, felly, ar ddiwedd y dydd, sy'n ni'n gobeithio fydd y mesur iechyd meddwl yma yn neud yn siŵr bod yna darpariaeth gyda for practice yng Nghymru.
Everybody from the GPs to the nurse practitioners to the practice nurses we can deliver training to. People like the receptionists who are at the front line for staff, for patients coming in through the door every day. We can train them on common mental health issues and help them understand why people present in the way they do and what difficulties they might be having.
The vision is that it supports and not supplants GPs. So GPs will continue seeing the majority of patients themselves and will continue managing most of those patients.
So GPs are still the first port of call, but with the extra resource provided by a primary care mental health worker. They'll be able to make an assessment of the patient's mental health needs. They'll have the kind of training that means they can offer certain types of brief therapy themselves. And they'll act as a resource, connecting patients and GPs with information, advice and other services. The aim is to address issues quickly, to help the patient back to a sense of well-being before problems become entrenched.
If I was a patient walking into my GP surgery with feeling unwell, feeling whatever, and my GP identifies that I am suffering with low mood, mild to moderate depression, anxiety state, then I would expect and hope that my GP will take an interest in my condition and engage with me, which is what we do basically. But in addition to the help and advice and treatment offered by my GP, he will be able to say to me, I'm going to refer you to the local primary mental health support service. The professional who sees me will identify what my key needs are in terms of support services, and either be able to start delivering that in terms of treatment and therapy on a one-to-one basis, or be able to signpost me to other professionals within the service that can deliver specific elements of psychological treatments.
A lot of work has been done to identify and resource and support, for example, charities and the voluntary sector to provide help and support, and recognising that somebody, for example, who's experiencing, say, some depression may actually benefit from some activities or may benefit from a bit of cognitive therapy, or if they're literate with the computer, may benefit from a computer program that they can work with or an internet program they can work with.
We see patients with a wide range of needs. Lots of factors might be impacting on their mental health problems, things like housing, debt, relationship issues. So we frequently refer people to voluntary sector organisations that deal with homelessness issues, people who've got behind with the rent, things like that are impacting on their well-being, domestic violence, debt agencies, all those kind of things in the voluntary sector. And then in the statutory sector, so we're talking about things like drug and alcohol services, post-traumatic stress disorder is a big, we refer a lot of people with that at the moment. So it's working across lots of interfaces, dealing with lots of different agencies.
Signposting, having somebody around with access to local services of good quality and can provide service at the right time, it's the key to everything.
The measure places legal obligations on local authorities and health boards to deliver a certain level of care, but leaves them free to provide services in a way that addresses local needs. The emphasis is on making support easily accessible and normal. This stress management course, held in a Llanelli hotel, fits the bill.
We've chosen this location on this occasion because we want to normalise the common mental health problems. We want to break down stigma And one of the big positives to the stress course is that it does that. There are lots of people coming here. It's in a very relaxed community location, and it just totally normalises it.
Before coming here, I was really anxious about it, and it was really great. They said if you want to bring your partner along, my partner came along, and that was reassuring as well. And straight away, as soon as I got here, I realised it wasn't sit around in a circle and have confessions in front of everyone. So no, it's really good.
Under control. Panic can be a big bully. It can stop you doing lots of things.
I think that everybody gets something different out of them. A lot of people use the CBT techniques that we deliver as part of the sessions. Other people come just for support, and I think they get a lot of motivation from the numbers of people that do come.
The idea is that the primary care mental health worker will become a resource, linking or referring patients to the most appropriate support, including those provided by third sector agencies, such as Cardiff-based ISA Wales.
ISA Wales is a support organisation. We offer social support to people from, most of our clients are from the Black ethnic minority and Muslim community. We provide counselling services, befriending and advocacy. That's through volunteers who will meet our clients one-to-one, maybe once a week, take them out for coffee, meet them for a walk, things like that. So just the kind of things that would help your mental well-being and help you to feel better. I think having a mental health specialist would be great, would be excellent. Accessing better support for your mental health through your GP will reduce stigma associated with mental health. And it'll help people to get support at the right time, at the right place, I guess, and without people having to be referred on to secondary services and, have all the stigma and the fear associated with that.
Fear, ignorance and stigma remain important factors in dealing with mental illness. The focus of Interlink is on empowering people who've experienced poor mental health and on giving them a voice.
We'll make a start now then. So my role in Interlink is to develop projects that enable people to become more involved and having a voice.
He gave them tablets to help him, and he said to come back in 3 weeks' time.
We're very interested in gathering people's stories about primary services and also secondary services as well in mental health, because I think only by hearing what service users and carers have got to say about those services is a good way of enabling those services to improve.
What patients say, and their doctors, is that there's a need to bridge the gap between primary and secondary care. The provision of additional mental health services via primary care put in place by the measure is one step towards that goal.
I think that there is a genuine intention to change the way the services are delivered, and the measure does set out in legislation that this has to be done. So I think I would say to people that there is a new service that is going to be implemented fairly soon, that will deliver proper services for these people. It isn't the panacea for all ills, but it does mean we will have something that we can offer patients more than our time and a prescription at the end of the day.
And I think if any GPs are concerned about mental health services in their areas, if any GPs are struggling to get good quality mental health services, now is the time where they put their hand up, find your local mental health manager and volunteer yourselves to get some time in there and go and shout, go and rant and rave at them and get these services developed to the way we need them to be developed for the good of our patients.
So what does the future hold for GPs and their patients in Wales?
Gyda'r mesur yn y dyfodol, mae'n golygu bydd yr unigolyn yn gallu cael gafel ar triniaeth iechyd meddwl yn y meddygfa yn gyflymach I atal y problem gwethygu. A mae hynny'n peth da iawn.
Well, I would expect that as the measure beds in, we won't have people becoming patients with conditions, because when the GP sees somebody who's having a hard time, who's having lots of symptoms, they can make a referral to the primary mental health worker. They'll have an assessment, they'll be given support, they'll be given a way out of their current situation. And therefore, as a result, they won't need tablets, they won't need a diagnostic label. And that will benefit not just them, but it'll benefit their families.
I think that all of us need to understand what the measure is about. And it is about taking very seriously the fact that at least 1 in 4 of us throughout our lives are going to have a mental illness or a mental health problem that requires some professional attention. So it's self-interest as much as anything else. Finding out about it, not necessarily in reading some of the language of the measure, is written by constitutional lawyers, and so it's not particularly helpful. But there are a number of organisations, and they include people like Mind Cymru, Haval, who've produced very readable summaries that help, in particular, service users. People on the receiving end of services understand what the measure's about, so that they're in a position to make different kind of demands about what's available. But similarly, I think if general practitioners can better understand the intentions behind the measure, they're more likely to understand how they could take advantage of it for the advantage of their patients.